All right, let's open up the case file on one of public health's most wanted criminals. We're talking about a hospital-acquired enforcer known for its stealth, its resilience, and some serious firepower. So, let's get right to it. You know, a lot of bacteria have nicknames, but this one, the carbapenem-resistant crime boss, this one really tells you everything you need to know. It hints at the very thing that makes this organism so incredibly feared, its power to resist our absolute last line of defense antibiotics. So, to really understand the threat, we've got to profile the suspect first. Let's dig into its identity and its key defining characteristics. Our suspect, Klebsiella pneumoniae, is a real heavy hitter in the notorious Enterobacteriaceae crime family. We're talking a syndicate that includes other infamous pathogens like E. coli. This family tree right here places it squarely among some of the baddest bacteria we face in hospitals today. In the lab, we use a unique biochemical fingerprint to get a positive ID. It ferments lactose, and it tests positive for urease. But, you know, a really key part of its profile is that it's non-modal. Unlike other bacteria that might try to flee the scene, this mobster doesn't run. It prefers to stand its ground and intimidate, rather than make a quick getaway. Okay, so how do we tell it apart from a close relative, Klebsiella oxytoca? Well, it actually comes down to one single chemical test. Our suspect is indole negative. It's a simple reaction, but it's like that one definitive clue that separates the real culprit from a lookalike, which, as you can imagine, is absolutely crucial for getting the diagnosis right. Now, one of the most striking tells for the really dangerous strains is something called hypermucoviscosity. In the lab, if you touch a colony, it pulls into these long, gooey strings. We're talking over 5 millimeters long. And this isn't just some weird party trick. It's a direct visual marker of a hypervirulent strain. That's code for one with a terrifying ability to cause really severe invasive disease. All right, we've profiled our suspect. Now, let's break down its methods. How does it actually operate? What's its MO when it decides to invade a host? The attack is nothing if not methodical. First up, entry. It's an opportunist, exploiting vulnerabilities like catheters, ventilators, or open wounds. Step 2, establishment. It uses its thick capsule like a shield to set up a stronghold and hide from our defenses. Then comes step 3, the assault. It starts destroying tissue and forming these protective biofilms. And of course, like any good criminal, it leaves a calling card. And this is that calling card. In really severe pneumonia cases, the thick, bloody, mucus-filled sputum that the patient produces has this distinct look. It's a grim but absolutely classic clinical sign that points the finger directly at KP pneumoniae as the likely perp. You know, a criminal is only as good as their tools. And believe me, this organism is armed to the teeth. So let's investigate the formidable arsenal that makes it so incredibly dangerous. Its weapons cache is pretty diverse and highly effective. We're talking about everything a top-tier criminal organization needs: body armor for defense, a theft operation to steal resources, tools to hold on tight at the scene of the crime, and of course, heavy artillery in the form of a powerful enzymatic arsenal. Let's break down some of its most critical weapons. Its number one defense is the polysaccharide capsule. Think of it as the mobster's body armor. It's this thick, slimy layer that physically stops our immune cells, our body's first responders, from being able to grab on and swallow the bacteria. It's a simple idea, but it's an incredibly effective shield. Next up, cytophores. Now, to survive inside us, bacteria need iron, but our bodies are smart and they hide it away. So Klebsiella deploys these specialized molecules that act like a sophisticated iron theft syndicate, actively ripping that essential nutrient from our cells so it can grow and multiply. But its ultimate weapon, the one that really earns it that crime boss title, is its enzymatic arsenal. Specifically, we're talking about enzymes called carbapenemases. These are basically molecular weapons that hunt down and destroy our most powerful antibiotics, the carbapenems, making them completely useless. And this right here shows you the ultimate consequence of that weapon. When this bacterium carries carbapenemases, it becomes what we call a CRE, or a carbapenem-resistant enterobacterales, and that single ability transforms it from just another manageable infection into a globally feared agent of hospital outbreaks. Okay, so we've got the profile, the MO, and the weapons list. In our final section, let's look at who this criminal targets, and then we'll deliver the final verdict on the threat it poses. The victim profile is kind of split in two.
The classic hospital-associated strains, they typically prey on the vulnerable, the elderly, people with diabetes, and patients in the ICU. But those hypervirulent strains, they're a whole different beast. They can strike young, healthy people out in the community, causing just devastating infections like liver abscesses that can spread all through the body.
And here it is, the final brutal consequence of that resistance. For bloodstream infections caused by these CRE strains of Klebsiella, the outcome is just grim. The mortality rate can be devastatingly high. In some hospital outbreaks, this number means that more than half of the infected patients will not survive. That is the true cost of a pathogen that has outsmarted our best medicines.
So after reviewing all the evidence, after looking at its identity, its methods, its weapons, and its impact, what's the final verdict on this mucoid mobster?
The final profile really says it all. This isn't just another bug. It is a formidable capsule-clad enforcer. Its combination of defensive armor, its resilience in the hospital, and an ever-growing arsenal of antibiotic-destroying weapons really cements its status as a top-tier nosocomial threat.
And that leaves us with the critical question moving forward, doesn't it? This pathogen is constantly evolving, it's constantly adding new weapons to its arsenal. The challenge for all of us, for doctors, scientists, and public health officials, is figuring out how in the world do we stay one step ahead of this microbial crime boss.